Hello, my name is Kira. I'm a registered nurse and alumni at CU Anschutz College of Nursing.
And I'm Becca. I'm a rising fourth-year med student.
We founded the CU Street Medicine program back in 2020, and this is our second time receiving the Innovation Awards grant, which has been super helpful in getting this project off the ground. Some background information, just as to like why this is important, is if any of you have like worked in hospitals and clinics, you will see a lot of folks experiencing homelessness, and like recurrent patients revisiting and like not having the same tools to be able to resolve their health issues and prevent health issues as the house population. Some of these statistics are pretty significant. People experiencing homelessness have a life expectancy around 30 years younger than the housed population. And there are around 7,000 folks experiencing homelessness in the Denver metro area. And that was from a 2022 survey on 24 hours in January. So that is like a January day count as opposed to like a summer count, which in my opinion, this is like a severe undercount. But with that being said, it's great data for the people that we do get to survey. And 20% of the people in the point in time survey reported they have a chronic health condition, and 30% reported they have a just chronic disabling condition.
Yeah, as Kira said, this is our second time getting the grant, so thank you. And this was actually, last time we got the grant was actually our first grant, and we now have received nearly $20,000 in grant funding through various sources. So just like really big shout out that this got us off the ground to begin with. So some of the challenges that we faced were that we kind of had a big idea, but didn't necessarily have like the connections to back it up. So we currently partner with 2 different cities and social workers in 2 different cities. And the police departments in both cities are how we made those connections. So that was helpful. The Street Dog Coalition provides free veterinary services for our unsheltered pets, which has been super awesome and was like an awesome way to get people to engage with us. Yeah, and then Thornton and Commerce City. And then we also partner with the National Street Medicine Institute, and we're recipients of the inaugural SEED grant for promising street med programs 2 years ago. So our locations we currently have about 3 to 5 street outreaches a week in partnership with our social workers. And so the social workers can't go out unless our students are volunteering with them. And so we fill those slots with Anschutz students, which has been awesome. And then in addition to that, we host pop-ups. And so Kira, as a nurse, is able to go on the street outreaches, but we can't always get a provider with prescriptive authority there. And so instead we have pop-ups so we can get a few more people for each hour that someone with prescriptive authority is there. And so that's when we partner with people like the veterinarians as well.
So we do, outreaches and then pop-up clinics, and the pop-up clinics are, like street medicine traditionally, where we are literally walking around Commerce City and Thornton with a backpack, with an outreach worker who has, significant rapport with everybody there. So, initially there was concern. It's like, oh, if it's a new student or a student volunteering for the first time, they don't come back. Like, what about the longevity and like, the connections? And, ideally, once people start to volunteer, they'll come back, once a month. And you see the same faces, get to know folks, people start opening up once they know you more. But having our outreach workers, who are like full-time employees of the city, and it is like their literal job description to outreach people experiencing homelessness, has been like a huge way for us to kind of jump that barrier in terms of like having trust with clients and patients. And I, as a nurse, I go out like every other week. It's like a wonderful way to, get to know people in your community, totally dissolve all the stigmas about people experiencing homelessness. I bring out students a lot with me. And, if other providers are interested, they are absolutely welcome to, work within their scope on an outreach. And the pop-ups are cool because they happen at resource fairs traditionally. So, like we are not the only service at these events. So like there's food pantries, laundry trucks, shower trucks, veterinary services, sometimes public health department is there doing vaccines. We are doing kind of like primary care screening and education and like basic medications and refills and everything for people, wound care, foot care, all that kind of stuff. So it's been like a lot of creativity in like thinking of like how can we maximize the care that we give to folks, even though it is like somewhat limited in like not having a brick and mortar clinic.
Yeah, and also just to clarify, the funding for this grant all went to us being able to provide foot care services, which if anyone has ever worked with the unsheltered community, they know is like probably one of the most, if not absolutely the most appreciated service. And we're now doing foot care clinics, and it's something really special that we can do that otherwise they wouldn't have access for. So just some statistics for 2022, and we're on track to probably over double all of these statistics this year. But we had nearly 40 unique volunteers, including 9 licensed providers who volunteered with us, over 600 hours of direct community volunteering. So that doesn't include like all the organization hours, admin hours, that's directly with persons experiencing homelessness. We joined or organized ourselves over 85 outreaches, including 12 medical pop-ups. We're definitely going to get at least probably 2 or 3 times that number of pop-ups this year because we're on quite a roll. So yeah, that's been really exciting.
These are some photos from our recent pop-up clinics. And there is something we should explain. It gets confusing because CU Street Medicine is a student group here at Anschutz. And when students come volunteer, they are volunteering underneath YHC Clinic, which is a local nonprofit that provides all of the funding and the liability for the students volunteering, as well as providers liability. So the other cool thing is that we can be interdisciplinary. We are trying to like branch out into like dental, huge need, physical therapy, there's a huge need, getting more PA students, public health students, social work students would be awesome. But yeah, it's just like a really cool way to get to connect with folks. And in our orientation for students and providers, we have like a survey that's kind of embedded in there. And one of the questions is like, do you feel that you receive like enough curriculum from Anschutz on like this patient population? And most people feel like they don't get a ton of education on specifically people experiencing homelessness. And even more so, people feel like they don't get clinical exposure to people experiencing homelessness or like caring for this population specifically. And it is like a huge chunk of people in the hospital and clinics. So people are going to see it in practice eventually. And it's great to like start dissolving these stigmas early.
So if you're interested in volunteering or joining a student group, feel free to email me. That's my email. So yeah, I can get you in on the listserv. And yeah, we're always looking for new volunteers at any level of training.
I have a question for you. So this is in regards to volunteers. How many unique volunteers did you have there? Did you say 38? Or did I get that number?
38.
Yeah. Is that all students? Is that alumni? I know you said you were an alumna of the College of Nursing. What's the makeup of the volunteers?
It's majority students or local providers, like local licensed providers who may or may not have graduated from CU. But sometimes other people through word of mouth do hear about us. And so we welcome students. We've had students rotate with us from other schools as well, non-CU affiliated.
Yeah, if you're super interested, I can send you a breakdown. It didn't look great on the slide. It's just like a lot of numbers. but yeah, it's a lot of med students, a lot of nursing students, and then mostly doctors and nurses we've had volunteer so far.
Okay, we'll have to connect because we work with the alumni relations shop with the other schools and colleges for students. So happy to help and get the word out there for future volunteers.
Yeah.
I'm just curious to know what the experience is like and how it differs between when you're with like a licensed medical provider and when you're not. What kind of things can you guys help the population with?
Yeah. Oh, you
got
okay. So it's a good question. So because we're going out with licensed social workers, so the social workers can't go out by themselves due to just like policies and safety issues. So one, just being like a physical presence. So even if a provider is not there, just being a presence is helping the social workers do their job. In addition, something that I myself have learned while going on social work rounds, and I've heard from a lot of other people, is that just being a listening ear is like really, truly, sometimes just showing up is so important. So for example, someone had lost her EBT food stamps card, and getting that replaced, if you've ever been on the phone with them, was a nightmare. And so me and the social worker and the, in that case, client, because it wasn't even medical, but we spent 3 hours on the phone with that woman, right? And we called so many different services, and like I was confused, the social worker was confused. And so, but that kind of stuff is like still what we consider like the real work, because that's something that just wasn't getting done. And this woman like truly wasn't eating in this case because she didn't have that. So we also help with things like getting people into housing lotteries. We're going to start distributing Narcan really soon. We have like dreams of sometime in the near future starting like clean needle exchanges and stuff, and just utilizing as much of that time on rounds to do as much as possible. And then, yeah, like anyone with a license can practice up to their scope. So we do provide the liability insurance for that. If you want to talk about challenges, talk to me about liability. But anyway, but so yeah, so for instance, Kira is able to do like amazing wound care, which actually nurses are like wound care wizards, way better than MDs in my opinion. And then versus when you're with working with an MD, then it's more focusing on like, okay, do you have access to your medications? What medications have you been on in the past? How can we get you back on those? But also just like preventative health screenings and having slightly higher level conversations about like overall trajectories of care.
Yeah, students are also able to hand out supplies and stuff. So we have, like feminine hygiene bags to hand out, wound care bags to hand out, kind of like, food snacks and stuff, body wipes, like trowels, whatever it might be, and then assisting the case managers with their work. So helping do a VI SPDAT assessment, which is like a vulnerability index tool used to put people into housing pools, food stamp stuff, getting vital documents. So it helps like as a medical student, just like seeing the system and like how hard it is to access these public benefits that ideally would be easy to access. And then it's like, there's a million different barriers, and we try to help navigate them as best we can.
Hi, this is Dr. Williams on Zoom. Tell me what you do about mental health. Do you have any mental health outreach?
Not yet. We've been trying to recruit some mental health providers. It is definitely a need. And like as a nurse, I can help de-escalate folks and refer to local clinics. And, be able to recognize crises and, screen for that kind of stuff. But to provide therapy on the spot, I am definitely not the person for that. And we would love to have kind of more direct service for mental health services and like being able to refill prescriptions, because that's a big barrier that we see for folks. But yeah, that's definitely something we want to grow in.
So I'm a former nurse, former family practice doc, current psychiatrist. So we should try to get together.
Awesome. Please email me.
Okay.
So you mentioned that you can do like basic prescribing out on the streets. What are the logistics like for ensuring follow up and like refilling those prescriptions if like patients aren't actually coming in?
we deal with that on a very much like case by case basis, and it also depends on the comfort of the provider. So just as a rule, we don't prescribe narcotics. So that's just kind of out to begin with. But then that being said, we do have like pre-filled pop-ups, like we have boxes of like prescribed controlled medications, not controlled, but like, yeah, sorry.
No controlled medications.
Yeah, no controlled medications, wrong word, but just like medications that are traditionally prescribed, but we already have them. So that way we can just fill them out. And then usually but you can usually tell when there's like a case where a patient is really going to need it. So that we have definitely had situations where like we've had student volunteers go and pick up the prescription and have paid for it and have made sure that then the social workers actually aren't allowed to give the medication out. So then in that case, the student goes out with the social worker and the student can physically hand the medication to the patient. And a lot of times we do have, when we're going to that length, like we do have longitudinal connection with that patient. So we have a way of ensuring that follow-up then.
Also as a nurse, like when I go on my street outreaches and stuff, a lot of times our medical director is willing to be on call. And so I'll, meet a patient with a need. It might be a prescription refill or something, and I can do, full history and physical assessment, and then call our licensed provider, Katie, talk through it with her. And she has actually been able to fill prescriptions for patients who have Medicaid, and they've been able to pick them up next day. And that's been like pretty huge, because, it doesn't take up a lot of her time. And this was a patient who was presenting to the emergency department every 3 months because she ran out of her inhalers, and we were able to get her 5 refills on her inhalers.